Hello and welcome back. My name is Lydia and this is Time with Lydia the Pharmacist. Today we are going to be talking about the treatment of scabies. But first of all, I'm going to give you a brief overview of the causes of scabies, the symptoms of scabies, and then we would move on to the treatment of scabies. So please don't go anywhere. Scabies is caused by an 8-legged mite called Sarcoptes scabiei. The female mite burrows just under the skin and makes a tunnel where it lays eggs. The eggs hatch into larvae and the larvae travel to the surface of the skin where they mature. These mites can then spread to other areas of the skin or to the skin of other people. Scabies is contagious and can spread quickly through close person-to-person contact in a family, a child care center, school classrooms, nursing homes, or prisons. Sexual contact and having multiple partners can result in one person with scabies spreading it to the other, and you can also catch scabies through contact with infected clothing and bedding, but this is a less common route of catching scabies. One important thing to note about scabies is that it doesn't transfer from animals to humans, only through human-to-human contact. And you know, anyone can get scabies. It has nothing to do with poor hygiene. Scabies can appear on any part of the body, and in adults and children, scabies is mostly found between the fingers and the toes, in the armpits, around the waist, along the insides of the wrist, on the elbows, on the chest, on the nipples, around the belly button, around the genitals, and in the groin area. Scabies can also appear on the buttocks. In infants and younger children, scabies normally appears on the face, on the scalp, on the soles of the feet, and on the palms of the hand. Now let's move on to the symptoms of scabies. If you've had scabies before, symptoms may start within a few days of exposure. If you've never had scabies, it can take as long as 6 weeks for symptoms to start. And the thing is, you can still spread scabies if you don't have any symptoms. Signs and symptoms of scabies include itching, often severe and usually worse at night. Thin, wavy tunnels made up of tiny blisters or bumps on the skin. A raised rash or spots. The spots may look red, but may be more difficult to see on a darker skin, but you should be able to feel them. It is very important that you visit your doctor or your community pharmacist anytime you experience these symptoms. Your pharmacist or your doctor will be able to diagnose scabies by performing a physical examination. Now let's move on to the treatment of scabies. Because scabies spreads so easily, your healthcare provider will likely recommend treating all household members and other close contacts, even if they don't have any symptoms. Scabies is not usually a serious condition, but it has to be treated. When you visit your community pharmacy or your doctor and you are diagnosed with scabies, there is a cream or lotion that you can apply. This cream is known as permethrin, and it's a 5% cream that you can buy for the treatment of scabies. This cream has to be applied on the whole body, including your face, your neck, your scalp, and your ears, then washed off after 8 hours. You need a reapplication 1 week after the first application. It is important to always read the patient information leaflet that comes with any medication that you purchase from your community pharmacy so that you know more about the medication, the possible side effects, and anything else at all that you need to know. And also mention to the pharmacist whether you're pregnant or you're breastfeeding, because there are some medications that cannot be used by pregnant women and breastfeeding mothers. The cream has got chemicals that will kill the scabies and their eggs, and is generally considered safe for adults and people who are pregnant and breastfeeding. Another cream that you can use for the treatment of scabies is sulfur cream. Sulfur cream is also applied overnight and rinsed off and then reapplied for 5 nights in a row. Sulfur is also safe to use in pregnancy. Another treatment for scabies is ivermectin. Ivermectin is a pill that you can take and is often prescribed for people with crusted scabies or lowered immune system. Ivermectin is not recommended for pregnant and breastfeeding mothers as well as younger children. When you have scabies, there are some things that you need to do to prevent the spread of scabies. As I said earlier on, scabies is highly contagious. These are the things that you need to do. Wash all your beddings and your clothing in the house at 50 degrees Celsius or higher on the first day of treatment. Put clothing that cannot be washed in a sealed bag for 3 days until the mites die. And stop babies and children from sucking the treatment from their hands by putting socks or mittens on them. Do not have sex or physical contact until you have completed the full course of treatment. And do not share beddings, towels, or clothes with someone who has scabies. I hope this video is helpful and you have learned something new today. Please give this video a thumbs up, share with your family and friends, and if you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you don't miss any of my interesting videos. Remember to leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.